This video introduces general observations of neurologic status and then focuses on examination of the cranial nerves, including assessment of the motor and sensory portions of cranial nerves 1 through 12, and examination of the sensory system, including assessment of pain, temperature, light touch, and vibratory sensations, as well as position sense and discriminative sensations. In this video, the examiner will assess a healthy patient. Your patients may have the same normal findings or may exhibit normal variations or abnormal findings. To perform the neurologic examination efficiently, combine portions of it with other parts of the assessment, such as the interview. When talking with the patient, observe the patient's mental status, speech, mood, memory, and orientation.
That is the reason for the headaches.
To assess its function, first be sure both nasal passages are patent.
Any problems?
No.
Then, with one of the patient's nostrils occluded and his eyes closed, pass a mildly aromatic and familiar substance, such as vanilla, cloves, soap, or coffee, under the open nostril.
Alcohol?
If the patient detects the smell, ask him to identify it.
Breathe in.
Repeat this test on the other side.
Cinnamon.
Cranial nerve 2, the optic nerve, mediates vision.
I'd like to test your vision now. If you could hold.
To assess its function, check the patient's visual acuity and visual fields and inspect the optic fundi.
Can you read the numbers on that?
If a Snellen chart is not available, test visual acuity by using a special handheld eye card. To do this, ask the patient to cover one eye, hold the card about 14 inches away from his eyes, and read aloud the smallest print possible.
4.
If the patient requires reading or general-purpose glasses or contact lenses, he should wear them.
Can you cover up the other eye?
Then test the other eye.
Thank you.
For screening purposes, visual fields are tested by confrontation.
Peripheral vision.
Face the patient directly and imagine a glass bowl encircling the head.
Towards the center.
Ask the patient to look with both eyes into your eyes.
Point. When you
Then place your hands about 2 feet apart, lateral to the patient's ears. Then slowly move the wiggling fingers of both hands along the imaginary bowl until the patient identifies them. Repeat this action in the upper and lower temporal quadrants. Normally, a person sees both sets of fingers at the same time.
I'd like you to cover up your left eye.
If you think you've found a visual field
I'd like you to
defect,
say now,
such as
when you
loss
see
of
the
vision in the right temporal field, slowly move your wiggling fingers from the defective area of the field toward the better vision. Repeat this at several levels until you can define the border of the defect. These responses suggest a defect throughout the temporal half of the
Cover up
field.
The other eye.
Test the other eye for an accompanying defect.
Look straight ahead at me.
Next, inspect each ocular fundus by using an ophthalmoscope. Assess the optic nerve by inspecting the optic disc. Note its color, the sharpness of the margins, and the width of the physiologic cup. Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves, control eye movements. Because these nerves work together so closely, they're examined as a group. The oculomotor nerve is also responsible for pupillary constriction and raising the upper eyelid. Check the position of the upper eyelids while the patient looks directly at you. The eyelids should be symmetrical and should not obscure the pupils. Next, inspect the pupils. They should be round and approximately equal in size. Size should be appropriate to room light. Test the pupillary reaction to light by shining a light on each pupil in turn. Observe for the direct reaction and the consensual reaction. If the light reaction is abnormal or ambiguous, test the patient's near reaction. Hold your finger or a pencil about 10 centimeters from the patient's eyes and tell him what to do.
Look at my finger. Look off into the distance.
Watch for pupillary dilation with distant gaze and pupillary constriction with near effort.
Look at my finger. Look off to the distance.
Repeat this test if necessary.
Look off to the distance.
Now check the extraocular movements in the 6 cardinal directions of gaze. From 2 to 3 feet in front of the patient, ask him to look at your finger as it moves to the patient's far right, to the right and up, to the right and down. Now move your finger to the far left, to the left and up, and to the left and down. These movements should be symmetrical and conjugate. Look for the jerky movements of nystagmus in lateral gaze and in upward gaze. Test for convergence of the eyes by asking the patient to look at your finger as you move it toward the bridge of his nose. Eyes can usually follow your finger to within 5 to 8 centimeters. The sensory portion of cranial nerve 5, the trigeminal nerve, mediates facial sensation and the sensory part of the corneal reflex. The motor portion of the nerve innervates all the muscles of mastication. To test the nerve's motor function, ask the patient to clench and then relax his jaw while you palpate the temporal muscles and then the masseter muscles. Note the strength of muscle contraction.
Relax.
The sensory portion of the trigeminal nerve has 3 divisions: the ophthalmic, maxillary, and mandibular divisions. All 3 areas should be tested symmetrically by assessing the patient's sensation of pain, light touch, and perhaps temperature.
I want you to close your eyes.
Explain and show the patient how you will assess for pain. Then, with the patient's eyes closed, test for pain sensation using the sharp end of a previously unused safety pin or other suitable sharp object. Occasionally, substitute the dull end for the sharp one as you test scattered areas.
Sharp. Sharp.
Now I'm going to compare side to side. Keep your eyes closed. Is this the same as this?
Then compare
Yes.
symmetrical areas on
This.
both sides of the face.
The same as this.
Yes.
If you suspect an abnormality, confirm it by testing temperature sensitivity.
Cold.
Again, explain the test first to the patient. Then, with the patient's eyes closed, test scattered areas. If indicated, compare sides.
Cold.
I'm going to test the sensation of your face by lightly touching the cotton against your skin. When you feel the cotton touch, I want you to say now. Now if you'll close your eyes.
Next, test for light touch using a wisp of
Now.
cotton. After explaining
Now.
the procedure, test in scattered areas.
Now.
Keep your eyes
Again,
closed.
compare sides.
Is this the same as this?
Yes.
To test
going
the
to
corneal
touch your
reflex,
eye
ask the
lightly
patient to
with
look
cotton.
up and away from you.
Look to the left and
Now
upward.
approach the patient from the side, out of his line of vision, and lightly touch the cornea with a fine wisp of cotton.
And can you look
Normally,
to
the
right
patient's
and upward?
eyes blink and tear, but a contact lens wearer may have diminished or absent corneal reflexes. Cranial nerve 7, the facial nerve, innervates all the muscles of facial movement and expression. It also mediates taste sensation in the anterior 2/3 of the tongue.
Which is
To assess this nerve, inspect the patient's face at rest and during conversation. Note any asymmetry and look for tics or other involuntary movements. Next, ask the patient to raise his eyebrows, frown,
tight.
close his eyes so tightly you can't open them, show his teeth, smile,
And puff out your cheeks.
and puff out his cheeks. Normally, the patient can do these maneuvers easily and symmetrically. Cranial nerve 8, which is the acoustic nerve, mediates hearing and vestibular function. Because vestibular function is not routinely tested, our exam will focus on hearing.
I'm going
To
do a
assess
simple
hearing,
test of your
occlude
hearing.
one of the patient's
I'd like you
ears
to
with
just
your
repeat what
finger,
I say.
stand 1 to 2 feet away from the patient, and cover your mouth to prevent lip reading.
2.
Now
4.
test the open ear by softly whispering numbers or words. Gradually increase your voice volume until the patient can identify the spoken numbers or words. If hearing is diminished, test for lateralization by performing the Weber test.
I'm going to strike the
To
tuning
do this,
fork,
place
and I
the
want you
base
to
of a
tell me what
vibrating
your
tuning
ears say.
fork firmly on top of the patient's head. Then ask if he hears the sound on one or both sides.
In the middle of my head.
Normally, the sound is heard midline or equally on both sides. Next, compare air and bone conduction by performing the Rinna test.
Tell me when you
Place a
stop.
lightly vibrating tuning fork on the mastoid bone behind the ear. When the patient indicates that the sound is no longer heard, quickly place the vibrating
do that?
fork near the ear canal.
Yes, I can.
Normally, the patient can hear the sound longer through air than through bone. Be sure to test the opposite ear. Cranial nerves 9 and 10, which are the glossopharyngeal and vagus nerves, mediate the sensory and motor functions of the palate, pharynx, and larynx.
I'd like to take a look at the back of your throat. Can you open your mouth?
To test
really
these
wide
nerves,
and say,
ask the
"Ah"?
patient to say ah or yawn as you observe the soft palate and the uvula. The soft palate should rise promptly and symmetrically, and the uvula should remain midline.
I'm going to ask
Next,
you to say, "Ah,"
test the
again.
gag reflex,
This time I'm
one
gonna
side at
touch
a
you lightly
time.
in the back of the throat.
Using a tongue blade,
Say,
touch
"Ah."
one side of the pharynx, then the other. You should see a prompt rise of the palate and other signs of gagging. Finally, ask the patient to swallow. It should be done without difficulty or regurgitation. Cranial nerve 11, the spinal accessory nerve, innervates the sternomastoid and upper trapezius muscles.
I'm going to test the strength of your shoulders.
To
I'm gonna
assess
lower
this
the head
nerve,
for just a
ask the
minute.
patient to shrug his shoulders upward
I
against
want
your
you to raise your
hands.
shoulders against
During this
resistance.
maneuver, evaluate the strength and contraction of the trapezius muscles.
Good. Can you turn your head to
Then
the right
ask the patient to turn his head to each side against your hand.
and relax?
Observe the contraction of the opposite sternomastoid muscle
Turn your head
and
to
note
the
the force of movement against your hand. Cranial nerve 12, the hypoglossal nerve, mediates motor functions of the tongue, which in turn affect articulation of words. Inspect the patient's tongue as it lies on the floor of his mouth. Observe for fasciculations. There should be none. Ask the patient to stick out his tongue. Note any asymmetry, deviation, or atrophy. The tongue should protrude straight out. Begin the sensory examination by
I'd like you to
assessing
lie
pain
down.
sensation in the arms, legs, and trunk. To do this, use the sharp end of a safety pin or other suitable tool. Ask the patient to close his eyes.
I'm going to touch you again.
Then, starting with the arms, test scattered areas, occasionally substituting the blunt end for comparison between sharp and
I'd
dull.
like you to say sharp or dull.
Then compare
Sharp.
sides and distal and proximal areas.
Dull.
Complete the
Yes.
evaluation of pain sensation with the legs.
Same as this.
Yes.
Okay. I'm going to bring your gown.
Next, test the anterior trunk. If you detect any abnormalities, evaluate the posterior trunk.
Okay. Keep your eyes closed again.
If pain sensation is abnormal, test the patient's response to
Cold.
temperature.
Hot.
I'd like you to keep your eyes closed, and I'm going to touch you again with the cotton. Say now when you feel it.
Assess light
Now.
touch with a cotton wisp.
Now.
Check the patient's
Is
trunk.
this the same as this?
Yes.
Is this the same as this?
Yes.
And say now again.
Now.
Arms,
Now.
and
Now.
legs.
Now. Now.
Is
Compare
this
sides
the same as this?
Yes.
Is this the same as this?
Yes.
Is this?
and proximal
Same
and
as
distal
this.
areas.
Keep your eyes
Next,
closed.
assess vibratory sensation using a lightly vibrating low-pitched tuning fork. Place the vibrating fork firmly over the distal interphalangeal joint of a finger and ask the patient to tell you what he feels.
Vibration.
Ask the patient to tell you when the sensation stops,
Stops.
then stop the vibration.
Stop.
Now test the other side. Normally, vibratory sensation is intact distally. If it is diminished, proceed to more proximal bony prominences, such as the wrist and elbow.
Once again, tell me what you feel.
Vibration.
Tell me when it
When
stops.
assessing vibratory sensation of the lower extremity, start with the big toes. Compare
What you
sides.
feel.
Vibration.
If vibratory sensation is diminished, check the ankle, patella, and iliac crest. Keep in mind that distal vibratory sensation may normally decrease with age.
I'm going to move your toe
For the next
up
part
and
of the
down.
exam,
I'm gonna
test
practice
position
one first.
sense. To do this, hold the sides of the patient's big toe
up.
with your thumb and index finger.
And this is down.
Avoid touching the other toes.
Now, can you
First,
tell me up
move
or
it
down?
up and down, identifying each position as the patient watches. Next, ask the patient to close his eyes and identify the direction of motion. Then, move the big toe up and down in an irregular sequence. Compare with the big toe on the other foot. In a similar fashion, test position sense in the upper extremities using a finger on each hand.
That's your hand.
To test stereognosis or object identification, place a familiar object in the patient's hand. Ask him to identify it.
It's a key.
Repeat the procedure on the other hand using a different object.
It's another object.
It's a button.
To
Might
test
put your
number
left palm
identification or graphesthesia,
Can you
use a
identify
blunt
the number
object
that
to
I'm-
draw a large number on the palm using a single continuous stroke.
7.
The number should face the patient, not the examiner. Test one palm, then the other.
9.
2-point discrimination is tested by asking the patient if he's been touched in one or two
Close your
areas.
eyes.
Sure.
Using two ends of an opened paper clip or the sides of two pins,
1.
repeatedly touch the patient's finger pad with the 2 points at the same time and with 1 point occasionally. Ask
1.
the patient to identify if he's being touched with 1 or 2 points. Then reduce the distance between the points so that you can determine the minimum distance at which the
1.
patient can identify 2 points. On the finger pad, the distance should be less than 5 millimeters. To test point localization, touch a point on the patient's skin.
Here.
Then ask him to open his eyes and point to the place touched. This test is especially helpful on the trunk and legs.
Here.
To test
Now I want you to
extinction,
keep your eyes
simultaneously
closed.
stimulate
Point
corresponding areas on both sides of the body. Then ask the patient to point to where he was touched. Normally, he should feel the sensation in both areas.
Here. And here.
In summary, the neurologic examination of the cranial nerves and sensory system includes general observations of neurologic status, examination of the cranial nerves, including assessment of the motor and sensory portions of cranial nerves 1 through 12, and examination of the sensory system, including assessment of pain, temperature, light touch, and vibratory sensations, as well as position sense and discriminative sensations.